Here the social worker, she is also one of the personal body in the scope of health nursing. So the training of social worker is she should have a one BSc and MSW or PhD degree with specialized training in mental health settings. Okay, even her role and responsibilities is a family case work and community placement of patients. Okay, even she need to go for community and there she need to get one patient and she need to go for the family and she need to get a case, psychiatric mental illness case. Okay, then the psychologist he should have a PhD or psychiatry degree with the research and clinical training in mental health nursing. Okay, even his role, psychologist role is psychological assessment and testing and treatment. Then the activity therapist should have a BSc degree with training in mental health settings, and his role or function is like he need to provide a recreational, occupational and activity programs to the patient. And the case worker should have a varying degrees of training, not only the related to psychiatry, various degrees also he can have, and usually he should works under supervision. Okay, somebody should be there with him to supervise because he don't have that much touch with the psychiatry. Then the case worker works and roles are helps patients to be maintained in community and receive needed services. Then the substance abuse counselor. Okay, substance abuse counselor, those who are addicted with the smoking, those who are addicted with the drugs. Okay, for them one special counselor should be there. His training should be he also should have any other degrees, and he should have a training in alcohol and substance used disorder patients. Okay, then his role and function is he is supposed to evaluate and treats patients with substance used problems. The last one is PR counselor. PR counselors are training is self identified as a consumer who is receiving or has received mental health services and is well grounded in their own mental health recovery, may or may not have a formal training. And the role and function of PR counselors are he is supposed to help consumers identify goals, and he is supposed to receive services that promote recovery and resiliency. Okay, these are the training and the personals and role or functions. Role of a nurse. Here the nurse role is a nurse. The nurse role in the psychiatric hospital setting, she is supposed to have a safe custody of the patients. Means she is supposed to play a role the safe, means for the patient's safe. Okay, patient safe also she is supposed to check, and carrying out various modalities, physical or psychological, and administration of the ward, and responsibility of health education to the patients and their relatives. She need to provide the her responsibilities. She need to provide a psycho education to the patients as well as the relatives. She is supposed to be admin for the ward, and patient centered and research minded responsibility she should have. She should maintain better adjustment and cordial relationship with her own professional colleagues, and she should play an active role in promoting mental health services. This is the psychiatric nurse should have these type of roles. Nurse in general hospital setting. What is the nurse in general hospital? Okay, in general hospitals also one psychiatric nurse should be there. Okay, like psychiatric nurse consultant in general hospital. Her role is she need to reduce the anxiety of normal patients, those who are suffering from the any type of diseases. Okay, the crisis intervention, that is short term therapeutic intervention to resolve immediate crisis or emergency using all available resources. Okay, even in crisis intervention times also she is supposed to support the people, and she is supposed to encourage the people to overcome from the crisis, and she is supposed to provide all the available resources in emergency conditions. Okay, to resolve the crisis, and she is supposed to provide counseling that is directed toward resolution of a health related problems. Even any other medical related problems, that may be like cancer, that may be TB, that may be brain tumor, any heart problems, or any related HIV AIDS. Okay, any other medical disorder patients are suffering with any medical problems. Okay, even a nurse supposed to provide a counseling to the people. Okay, The nurse in community mental health services, even not only the mental hospitals, not only the general hospital, even a psychiatric nurse should supposed to play her role in the community areas. Okay, community areas. Okay, a community mental health services in she need to have a in community a nurse, psychiatric nurse need to have a health promotion. She supposed to promote the health in the patients, including participation in health education programs, working with special groups, that is pregnant women, elderly and adolescents, and helping the authorities in changing the attitude towards mental illness, and activity with the individual, the family or special groups, preventive action and case finding, ensuring continuing care, participation in studies with regard to community needs, and participation in rehabilitation programs. Okay, these are the psychiatric nurse need to have in a community area. These are the her responsibilities. Okay, in community. Okay, psychiatric nurse, even she need to participate all health education programs. Even she need to work with all the like a special group of people, that may be pregnant women, elderly women or adolescents, and she need to help the all the authorities change their attitudes towards the mental illness, and she supposed to be active with the individual, family members and special groups to prevent the cases and to prevent the actions and to find the cases. And she is supposed to have a good communication skills, and she is supposed to have a good continuing care, and she is supposed to participate in all the studies with regard to community needs, and she need to participate in the rehabilitation programs. Okay, these are the psychiatric nurse need to have a, these are the roles. Okay, here comes, okay, here we have discussed about challenges which are there in the psychiatric nursing as well as the scope of mental health nursing. Okay, under the challenges we have seen like stigma, about stigma and stigma challenges, and stigma illness and anti-stigma strategies, and in healthcare delivery system also one of the challenge under that physical design challenge, about related to physical design, challenges related to patient characteristics, and challenge related to therapeutic role, challenge related to staffing, challenge related to psychiatric nursing education, and challenge related to the psychiatric nursing research. And we have discussed about scope of psychiatric nursing. Under the scope of psychiatric nursing, we have seen all the multidisciplinary scopes and the role of nurse in psychiatric hospital and general hospitals, and as well as the community health hospitals, community health services. Okay, this is the about challenges and scope of mental health nursing. Okay, thank you ma'am, thank you everyone.